Assalamu alaikum guys. In this video we are talking about the epistaxis. The are bleeding from the nose. It is a frequent condition. The most common cause is nose picking. The bleeding may be arterial or venous, and most episodes occur on the inferior portion of the septum and involves the septal branches of the spinopalatine and the facial vessels. Maxillary sinus. The maxillary sinus is the pyramidal in shape and located within the body of maxilla and behind the skin of the cheek. The roof is formed by the floor of the orbit, and the floor is related to the roots of the premolars and the molar teeth. The maxillary sinus open into the middle meters of the nose and through the hiatus semilurinus. The median nasal furrow, in which the nasal septum has completely split, separating the two halves of the nose. Note that the external nares are separated by wide furrow and the lateral proboscis. The two frontal sinus are contained within the frontal bone. They are separated from each other by a bony septum. Each sinus is roughly triangular, extending upward above the medial end of the eyebrow and backward into the median part of the roof of the orbit. Each frontal sinus open into the middle meters of the nose through the infundibulum. Two sinus lies within the body of the sphenoid bone. Each sinus open into the sphenothomic recess above the superior concha. The sinusitis and the examination of paranasal sinus. The infection of the paranasal sinus is common complication of the nasal infections. Rarely the cause of the maxillary sinusitis is extension from the apical dental abscesses. The frontal, ethmoidal and maxillary sinus can be palpated clinically for the areas of the tenderness. The frontal sinus can be examined by pressing the finger upward beneath the middle end of the superior orbital margin. Here the floor of the frontal sinus is closest to the surface. The ethmoid sinus can be palpated by pressing the finger medially against the medial wall of the orbit. The maxillary sinus can be examined for the tenderness by pressing the finger against the anterior wall of the maxilla below the anterior orbital margin. Pressure over the infraorbital nerve may reveal the increased sensitivity. Detection. Directing the beam of the flashlight either through the roof of the mouth or through the cheek in a darkened room will enable a physician to determine whether the maxillary sinus are full of the inflammatory fluid rather than air. The method of transillumination is simple and effective. Radiological examination of the sinus is also most helpful in making the diagnosis. One should always compare the clinical findings of each sinus on the two sides of the body. Thank you so much guys for watching the video. Keep watching, keep supporting.